It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really changing people's lives. Up first on today's show, we're going to hear from ear, nose, and throat specialist, Dr. C.T. Nguyen.
I would wake up every morning sneezing. You know, I'd go into the bathroom and I'd sneeze over and over again, and really prevented me from doing any yard work. And so I would just kind of stay in the house and as much a filtered environment as possible.
Barry came to see me because he can't breathe out of his nose. He reported having nasal congestion, facial pressure, headache. And in addition to that, he suffered from obstructive sleep apnea that require him to wear a CPAP every night.
It started back when I was in grade school, and it just has gotten worse and worse and worse over the years. And most of the other doctors I've always visited would treat symptoms. I just assumed that's all they could do. And when I went to see Dr. Nguyen, he said, no, here's the problem and here's a solution.
We noticed that Barry turbinate, which are structure on the side wall of his nose, are very swollen, restricting his airway. Also, Barry's sinus narrow and prevented him from breathing well. We discussed those findings with Barry and agreed upon a plan of treatment. First, reducing the size of the turbinate, allowing him to breathe better, and also using a small balloon to dilate the natural passage of his sinus cavity.
It took probably 2 weeks to feel really great. Progressively over that time, the breathing improved. You know, it's amazing. I told him I've never ever been able to breathe through both sides of my nose, and now I can.
After going through a small procedure in office of 45 minutes, now Barry enjoys life, breathes better, do more outdoor activities, and the most important thing, it reduced his dependency on CPAP machine, and he now can sleep better.
I was amazed because it was like finding somebody that was really willing to just do something more than put a Band-Aid on it. It was really exciting.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
Dorothy, she had multiple teeth that were decayed and she had failing restoration. So she had a history of having multiple dental procedures on her natural teeth. And these restorations had subsequently failed over time, secondary to wear as well as decay.
I came to see Dr. Metz and I was, of course, just knocked out. My heart went, he was so nice and encouraging. He said, yes, I think we can help you.
At 90 years old, she had all her lower teeth removed and placement of 4 dental implants and also placement of an immediate prototype, so to speak. So she had fixed teeth on the day that her teeth were removed.
Right, I had no problem whatsoever. It worked. I could eat and chew and I looked normal. And I was just perfectly happy with it.
Her situation is not unique. There's many people in her age group that just by virtue of their age, their teeth are beginning to fail. Many of them are under the misconception that they're too old to have oral surgery safely. Although by virtue of their age, that age bracket, we do more implants in that age bracket than any other age bracket. So they do tremendously well with it, just like somebody much younger. And also their health improves afterwards.
And I just was thrilled. That first steak was like out of heaven. It was paradise. You know, it was just wonderful. I was so thrilled and happy.
You know, with their fixed teeth, they're able to chew what they want and not foods that are high in sugar. And so they're healthier in the long run. For one, they're not fighting infected teeth. They have a healthier state in their mouth and they're able to chew what they want. And they're able to have a much more balanced diet.
I would say, don't do that. Don't tough it out. Go get something done. Go get some dental implants and be comfortable like I am.
When you ask these individuals after they've had this procedure done, they say they feel more energetic. They just feel better. And then we feel that it's their body not fighting a chronic infection, that they're in a healthier state overall.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. All of the doctors that you see on our show today have profile pages on our website, BestDocsNetwork.com, complete with bio, videos, and even a map so that you can find their office. And that includes our next doctor. It's vein specialist, Dr. Peter Morgan.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They said, well, you know, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly. And we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well, went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Hi, I'm Dr. C.T. Nguyen with Houston Sinus and Allergy and Best Docs Network. Do you know there's a simple solution to reduce your allergy symptoms? Wash your hair at night. It removes pollen and dust, so you don't breathe them in while you sleep. To learn more on this and other topics, please watch my video at bestdocsnetwork.com.
For more information and to watch hundreds of videos on the amazing doctors that you see on today's show, head to our website. It's bestdocsnetwork.com. Now it's on to our next best doctor. It's interventional cardiologist, Dr. Annie Varughese.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varughese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Dried plums or prunes are packed with polyphenols, a plant chemical that has been shown to boost bone density by stimulating your bone-building cells.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, #1, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the 3rd largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we're able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Shingles is a bad infection. It is very painful. When you have chickenpox, that chickenpox virus
ends up living in your spinal cord nerves. Later in life, when your immune system is weakened by some infection or just fatigue and overwork, the virus comes out along the nerve or around either your chest or your leg or your low back and causes painful blisters that have fluid in them. Now, if you have shingles, you can't give someone else shingles, but the fluid in those shingles blisters has the chickenpox virus in it, your chickenpox virus. If someone hasn't had chickenpox, they're susceptible to chickenpox from that virus in the blisters of your shingles. So you should stay away from people who have not had chickenpox or people who are on chemotherapy or have an immune system that doesn't work well, because they can really get a bad case of chickenpox from your shingles blisters. Now, you can prevent shingles by getting a shingles vaccine. Very expensive, but approved and usually covered by insurances at age 60.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, you know, I went through this trauma with the breast cancer, now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get, what would you say, a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
To request an appointment with any of our outstanding doctors that you see on today's show, head to our website, bestdocsnetwork.com. Go to the doctor's profile page and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's Podiatrist Dr. Gabriel Maislos.
So Ms. Gudelia Armas, she came to my office and she complained of a short 4th toe. This is a congenital deformity. We call it brachymetatarsia. And essentially, the 4th metatarsal stops growing and it's not as long as the other metatarsals. That causes a short 4th toe and a floppy toe.
When I was 10 years old, my foot started to hurt every time I used slips or like shoes. It bothered me a lot. Basically, I couldn't wear a lot of shoes or tennis shoes because it would bother me.
Cosmetically, it's disturbing, as well as it can cause problems, you know, physically, and pain and other discomforts.
I really didn't thought there was a possibility we can do that, but when we came here, the doctor actually told me, yes, there is a possibility you can actually do it.
The procedure is done in an outpatient setting. It takes about an hour and a half to 2 hours to do, and then, you know, the patient goes home. And outside of coming in for dressing changes, suture removals, most of the work is done at home and just involves turning a knob 4 times a day. It does require compliance, as far as not excessively weight-bearing and really risking injuring the operative site.
It's been 8 months since the surgery, and I've been able to run better. I can walk faster. I can do a lot of stuff now since it's over.
The procedure itself is not painful, but it does take time. We can't make bone grow overnight, so it can take 2 to 3 months, but in the end, it's really, dramatic results, which you can see from the x-rays as well as the pictures for Miss Artemis.
It's better because I can run better, I can wear my shoes more comfortably. I don't have the feeling that, oh, I can't wear my shoes because it's gonna hurt. It's really better. I can do a lot more things than before.
Be sure to wash your sheets and other bedding in hot water that is at least 140 degrees Fahrenheit to properly sanitize and remove dust mites that can irritate sensitive skin and exacerbate eczema. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. Some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier, that came here to get it fixed. Because they're more desperate sometimes than the people who had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, and she's talking to everybody about it. And so I love that. And getting Facebook posts from patients and talking about how I love my dentist and things like that. That's awesome. There's a lot of satisfaction in that, and I really enjoy that.
That's going to wrap up this edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website. It's bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story of your own, send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.